Good afternoon. Hello, North Dakota. Thank you all for tuning in today. I want to lead off with gratitude today because we often thank specific groups when we're here today, but I just want to say, share my gratitude with everybody who's listening. There's so much credit to share across our entire state because the whole state's been amazing. People have been smart as we were dealing with something that was unknown and unforeseen. And people were empathetic, they were considerate, they were thoughtful. As we know, in North Dakota, when we faced emergencies in the past, whether it's floods or blizzards or fires, North Dakotans, it often brings out the best of people in our state. And this pandemic has been no different. It's been really incredible to hear all the individual stories of families and neighbors and communities. And everybody, whether they're working on the economic side or the healthcare side, or just being a parent or a friend or a neighbor, there's been just amazing things happening. And we should never take for granted all those little things that people have done to help each other get through this incredible challenge that we're facing. And as always, for Lieutenant Governor Brent Sanford, First Lady Catherine, and myself, it's an honor to represent the people of North Dakota. And more than usual, we've had an opportunity to represent our state on the national level. Yesterday, we had the 19th video conference call with either the president or the vice president. Yesterday was the first one with First Lady Melania, and again, the opportunity for us to represent all of you, and I have to say the First Lady of North Dakota also doing a fantastic job representing our state. So thank you to Catherine for your courage and for your inspiration for people that are challenged as they work through their recovery at the same time they are in this pandemic. I want to say, too, also that the great work that everybody in North Dakota has done is, again, I think North Dakota is coming up as an example among all states as people who've done a great job of both saving lives and saving livelihoods. And as today, we've got this incredible, beautiful day happening across the state. And I know when I grew up in Arthur, about this time of year is when the lilac bushes would start blooming in the backyards. And it was when you see the trees blooming here and the plants coming. I guess they're all reminders for all of us that life begins anew. In each of us has an opportunity to grow, to learn, to become our better selves. And these reminders of spring coming, because spring is truly here. And it's not here in a little bit like you think it's here, and then it's a fall spring. I mean, today is one of those days where spring hits you in the face. And it's a wonderful thing, and I think it should give us all encouragement as we look forward and optimism to the future, because there are so many positive things happening in our state, and we're going to talk about some of those right now. But as we lead with gratitude, we want to also go into the why. Why are you tuning in? Why do we always lead with numbers each day when we talk about this? Because to get through this, we need both our heart and we need our head. And when we talk about numbers, which we do a lot, it's really been focused around a couple things, and specifically around testing we talk a lot about, because testing is the thing that allows us to find out, as we say, this invisible enemy that we've been fighting. Testing is the way for us to find out where it is. And sometimes it truly is invisible, because people can carry this disease, which can be deadly to those that are elderly and have underlying health conditions, and you can have no symptoms yourself. And so testing allows each of us to know where we stand relative to this battle against this enemy. And then once we find out who maybe have tested positive, then the tracing part of this is to understand who they've been in contact with and who it may have been transferred to. And then if we can identify those individuals and isolate those, this is what allows us to really stop the spread. This is what allows us to have our economy not open a little bit, but this is the skill set that's going to allow us to have our economy more fully open if we've got really great capacity going forward for the foreseeable future around identifying, tracing, and then isolating. And again, so our whole North Dakota Smart Restart is built around this, and that's why we're putting so much energy. And again, I have gratitude for all the people that are working in testing and contact tracing across our teams and the leaders that have stepped up to help lead that, both at the state and the local the local level. And again, as we know, we're doing great work in this. We are in number 2 in the nation in terms of testing per capita, and we've been identified as being the number 1 in the nation in terms of what we're doing in contact tracing. And the reason we're doing this is because this is going to allow us to get our economy going again, perhaps sooner and safer than others. Today, the North Dakota Health Department confirmed 63 additional cases of the novel coronavirus disease, or COVID-19, out of 1,990 tests that were conducted, and that would again be for the 24-hour period of yesterday, meaning Monday. Of those, 1,170 were newly tested North Dakotans, tested for the first time. 820 of those were repeats or serial tests. That brings today's positive rate to 3.2%. And so what is it about all these serial testing? When we take a look at this chart, which we started showing last Friday, the dark green represents those people who have had been tested more than once. And if you're someone who's working in healthcare, maybe you're working in a long-term care facility, you might have been tested multiple times. If you're a resident in a long-term care facility, you may have been tested not only twice, but maybe 3 or 4 times as we've worked to confirm and arrest the spread of long-term of the virus in those areas like long-term care, where it is actually the most dangerous. And so again, this testing, so as we said, we're going to start reporting both of these numbers, our total tests completed, and also those new individuals that are tested. When we report the numbers nationally and we compare ourselves on a per capita basis with other states, we're only comparing the light green portion of this because it's individuals tested within a state that represent what the CDC is tracking. And now when we say we're number 2 in the nation per capita, we have tested over 7.5% of the state of North Dakota individuals have now had been tested, and a percentage of those have been tested more than once. When we take a look at our actives, which is an important measure of what our activity is in terms of trying to manage this, it's 680 is the active confirmed. That's a plus 12 from yesterday. And how we got to that was that we had a number of recoveries, as well as 1 death. And again, so now we're at 45 deaths total for this. And this was a man in his 90s. In Cass County with underlying health conditions. And again, as always, from the First Lady and myself, our hearts go out to the loved ones who've lost a father or a grandfather. And regardless of what the loss of life may be, we know that's tough to lose individuals. And so, again, our hearts go out to all of you. But as we look at the active cases on a trend line here, the light green, that's the cumulative cases, or excuse me, this is light green is recovered cases. So we are excited to see that go up. Those crossed a couple of weeks ago and have continued to separate. But what's really important for us to look at is that blue line where we've got 600 actives. That peaked 13 days ago at 739 actives. So we've gone 13 days below our peak. Remaining in this flat zone is exceptionally a good place to be, particularly when we are really getting more targeted and more focused on our testing. When I say that, we're not just doing the broad, hey, come one, come all, we're going to test in a geography or county. When we're doing testing now with these targeted testing plans, we're looking for people that have been exposed to this through direct contact or through their workplace. And so we would expect that we would continue to find positives. That's a good thing, because when we find more positives, then we can move towards the isolation portion of this and help arrest the spread. And so again, this chart is looking really good with a strong increase in recovereds and flat on actives and very low number of deaths. Positive rate. We take a look at the 14-day average. We can see this is up slightly. Our low point was 2.1. It's up to 2.5, and this is a cumulative 14-day average that we're looking at. This is one of the gating factors which we looked at back on before May 1, which is one of the White House's gating factors. But again, at this rate at 2.5, that's a very low rate compared to virtually every other state in the country, and we expect that this may continue continue to climb slightly. It'll stay very low, but as we continue to do the targeted testing, we may see that come up. When we take a look at let me give an update on Cass County, and then I'll talk about the Red River Valley Task Force. But let's pull up the Cass County slide. Of the active cases that we have in the state, which we've talked about here, the majority of those, 490 of those 680, are in Cass County, and that puts us at an active rate almost 3 times the active rate per 10,000 people in Cass County versus the rest of the state. And the positive rate, well, again, for this whole state of North Dakota, since this has been undertaken, is 3.4. The positive rate for Cass County, 9.5. And the whole point of the Red River Valley Task Force was to try to make sure that we could get that positive rate and get all of that down to where it would match the much lower state level. So that's what we're going to continue to focus on. But an update from the Red River Valley Task Force is, again, that a enhanced local testing matrix is being deployed starting tomorrow, and this matrix will be based on target groups identified by the task force and will incorporate epidemiology data to determine testing needs. Family health care, which we've talked about, is continuing to provide testing to existing clients as well as those in a variety of other populations who may have higher COVID-19 risk and who would qualify to receive services through their clinic. Again, if you're an existing family health care patient, go there. But if you've got another provider, they're all providers in Cass County and all providers across the state. We're going to release a list of those, so that everybody can know where you can go in your county to get tested. But we've got testing capability across the entire state. So if you feel a need to get tested, please do, and call your provider before you go in. And again, other areas focused testing will include congregate living settings. So again, we've nearly completed. I think we've got a couple left out of the 218 long-term care facilities in the entire state have all been tested, but some of those in the Cass County area where we had high number of positives and a high number of residents, both positives in both residents and staff, we've gone back and tested some of those. Again, that's where you see that serial testing number being high. And we've also, the Red River Valley Task Force has got a communication education subgroup, is developing materials that can be shared with partners who work with and provide support services to vulnerable populations in the community. And of course, that includes those in shelters, whether it's homeless or domestic violence or other congregate living. Next topic is a really fun story and of collaboration. Another exciting thing when in North Dakota where we can get everybody around a table and solve a problem. That relates to basic care. And North Dakota is unique that we have a healthcare model and healthcare program actually called basic care. A basic care facility is similar to a nursing home, but for seniors whose medical needs are not as intense. And North Dakota is the only state that has a program that's fully paid by the state. So there's no Medicaid or Medicare match part of this. This is a fully paid program, and there are currently 1,143 seniors in basic care facilities across the state, and the state pays for a portion, in some cases, significant portion of their room and board to live in that basic care facilities. Because these were North Dakota programs, when we had the great work done by our CODEL, Senators Hoeven, Senator Kramer, Congressman Armstrong, in Washington, D.C., working on the CARES Act, and that came out, there was a $1,200 check that was going to go to every individual, every adult in America. Because of the federal legislation, and there's income eligibility for whether or not that check would count as income towards some Medicaid or Medicare paid federal matches or federal matches that would say if your income is above a certain level, you do or do not comply. But with this being a North Dakota program, so the federal government waived all of the requirements on income related to those these $1,200 checks. So these were just for individuals to keep, and they wouldn't count towards your income. But because we had this unique thing, which is a program called Basic Care, it was all North Dakota, when the federal government waived those rules, that waiver did not apply to the laws in North Dakota. So under the law in North Dakota, that $1,200 would count towards your income, and therefore would have been essentially taken and applied towards your basic care income levels. And we know that this is not what Congress intended, and we certainly know this is not what the White House intended. And so we have been working for several weeks to try to make sure that North Dakota residents who are in basic care, who are also another program called Service Payments for Elderly and Disabled, sometimes also known as SPED, where there's 1,300 participants. So we had almost 2,500 North Dakotans who were in a position where federal government was trying to give them $1,200, but our state law would have required the state essentially to grab that. And nobody wanted that to happen, certainly not our legislature and certainly not our executive branch. So again, the legislative leadership, the Attorney General's office from North Dakota, the Governor's office, Department of Human Services, and its Executive Director, Chris Jones, all sat down and came up with a solution. And I again want to thank particularly Senator Rich Wardner and Representative Chet Pollert, the two majority leaders, because they certainly took the lead on working this through, and we went through at least 6 different alternatives, and we came up with one that works, and that is that our administration has asked for an emergency rule change that will allow North Dakotans in basic care facilities to be able to use that $1,200 stimulus check however they choose, and it will not apply towards their income that would go towards the basic care. Chris Jones signed that emergency rule request yesterday, and so the way the process works is he sends a letter requesting that. I signed a letter, an authorization letter today, approving that request from Chris Jones. It takes effect today, and then that will remain in effect as the legislature works through the formal administrative rules process to suspend these rules, which would have impacted those $1,200 checks. And again, this is very important because we know that there's discussion going on in current stimulus bills in DC about similar checks coming in future stimulus bills, and hopefully this will take care of any future checks as well during this pandemic emergency. Department of Human Services is working with eligibility workers to educate them on how to deal with this. So we ask a little bit for your patience, because now that we've just got this signed, this administrative rule change, then we will again educate people on how to do this. I know that many of you have been concerned about your senior loved ones that are in this facility setting. We know that it's been super trying because of the visitation rules that are in place. But basic care residents, again, can use these however they funds they want to purchase, and whether that's for buying a grad gift for their grandkids that may be graduating, or they want to use it for their own expenditures, or if they want to use it to buy an electronic device to allow them to stay in touch with family. This is all entirely up to them, so we're pleased that we're able to get that sorted out. So again, I want to thank all of our legislators, Attorney General Stenjum and the DHS team. Chris Jones is here today and can answer questions after this, but again, thanks everybody for working to make sure that this intended relief makes its way to our North Dakota citizens as it was meant to be. Next is another executive order, and that has to do with K-12 scholarship deadlines. This is an amendment to one that we announced last week, talking about requirements for. No, actually, this is not. This is a brand new one. This is a brand new executive order. This one relates to the requirements for academic and CTE scholarships available to K-12 students. If you've got someone in high school, you may know that there's a very robust set of scholarship programs in North Dakota, and those are offered through a variety of programs, generally to high school juniors or seniors that are getting ready to enter either a career education or college of some sort. And there were some things that were in state law related to that in terms of what academic levels they had to have. And as they and this is sometimes called the C or higher, related to a letter grade. And this executive order will suspend this. We've worked with DPI, we've worked with the university system, we've worked with all the people in the scholarship business, but there is certainly some students that have had fabulous and great academic careers, but for a variety of reasons, pandemic related, they may have had a grade in a course that has fallen below a C as they adjusted to distance learning. And again, so we're waiving that for this 2020 spring semester related to this period of time. And this will also, DPI will waive the C or higher requirement for this semester when doing scholarship eligibility reviews for each of the next 4 scholarship review cycles. So if you're someone who might be graduating in 2021, 2022, or 2023, you're graduating in 2023, freshman year of your high school was the year of the pandemic, and you had a grade that fell below a C this spring, that will be waived, because this was something that was was written into the rules for these scholarships. We want to make sure that students don't miss out on a scholarship simply because they may have struggled to adjust to distance learning and achieved less than a C grade. And we want to, again, encourage all those students to, as we can with these financial scholarships, to have them continue to pursue whether it's a career and technical additional education or college education, associate's or bachelor degrees. So that's that executive order. That's a new one. Now, the one that is an adjustment, Executive Order 2020-04, was the one that Superintendent Baszler and I discussed last week. Superintendent Baszler is here today to answer questions. She and her team has been working closely with school superintendents and school boards since we made that announcement last week. As it is the case when we make these announcements and you've got hundreds and hundreds of school buildings across 175 districts. There are lots of uses and lots of different spaces and lots of ideas about how to do that. And so we want to make sure, the superintendent and I, make sure that local school boards and local superintendents have all the flexibility they need to do their North Dakota K-12 Smart Restart guidelines. And in doing that, this amendment allows for school superintendents in consultation with their local schools to offer limited programs or limited building use that's determined to be necessary, to be determined to be safe, and determined to be appropriate. So this is to provide greater flexibility, because we know that one order can't cover all situations in every building in every district. So again, local control, live and well here in North Dakota. Please check that out and we feel comfortable that we've included all the flexibility that we knew that superintendents and school boards were looking for, and balancing that with the safety of the faculty and the students. On unemployment, I want to give a brief update on that as well. We got some good news here. When we were one of the lowest states in the nation in terms of unemployment, it's never fun to be talking about numbers that have gone up dramatically in a short period of time in terms of unemployment. But we also, when we take a look at our unemployment relative to other states and relative to other parts of the nation, I think again North Dakota can feel great. Job service released today it's not seasonally adjusted, but the unemployment rate of 9.2%. This is high. It went up by 6.5%, or from March to April. This is not as high as we might expected it to be, and our seasonally adjusted unemployment rate of 8.5% remains low compared to that national rate of 4.7%. This is with a significant increase in unemployment in North Dakota. We need to also remember that some of this is related to demand destruction from the global economy shutting down. We've seen a 22% decline in jobs year over year, particularly in the oil and gas industry, and that was early on almost exclusively where the unemployment figures were coming from, because some of those showed up for weeks before we got actually into the heat of our COVID battle. Our largest decline year over year was in leisure and hospitality, with a 52% decline in jobs. That would be largely due to the impact of COVID-19 on food and drink employment. On this chart that we're showing here, it's important. We want you to look at the red line. as well. The gray shading shows that we've had a total of 79,300 regular claims. We've had 12,564 pandemic unemployment assistance claims and 13,350 pandemic unemployment emergency claims. And North Dakota has paid out $278.8 million in benefits to North Dakota workers just in the past several months. And so again, thanks to everybody in job service who's been working overtime and extra hours to deal with what has been more than 3 years, closing in on 4 years of claims in just a couple of months. But the number of claims has been declining since the beginning of April, which is great, and claims continue to come in. The number of individuals certifying their unemployment is beginning to decline. And certification is that weekly activity completed by claimants that triggers a payment as people return to work. They quit certifying and they quit requesting payment. So between this last week, the number of certifications dropped nearly 2,400 for the first time since the beginning. So that means that 2,400 people would have gone back to work, and that really coincides. That's at the first days of May. That would coincide with the reopening, the North Dakota Smart Restart around May 1st. And we're hopeful that North Dakota unemployment numbers will continue to show a sustained decline as economic activity returns safely and smartly to North Dakota. Continuing on, but on another note on unemployment, it's unfortunate, but in times of crisis, there's always those that seem to want to take advantage of a situation. And nationally, states are reporting an increased number of fraudulent unemployment insurance claims in conjunction with unprecedented increase in claims volume. In North Dakota, sadly, that's no different. And in job service, in cooperation with the Attorney General's office, is working to identify and investigate suspected fraudulent claims to ensure that all benefits are paid to qualifying North Dakota workers. Job Service North Dakota uses multiple types of fraud identification and prevention tools, but the most effective fraud prevention tool is available to North Dakota's employers, and that is when an unemployment insurance claim is filed, a notice of claim is sent from North Dakota Job Service to that employer. And if that employee has worked for you at any point in the last 18 months, it's critical that employers review these notices and let Job Service know if the individual is still working, or if the claim has come in and it's somebody they don't know and has never worked for them, and if they think the claim is unexpected or suspicious. The partnership between our businesses and North Dakota Job Service is critical in preventing fraudulent claims. Thank you for helping to limit their impacts by carefully reviewing the notices of claims you receive and other materials from Job Service. And again, in this day of cyber risk, we know that this could also be that there's actually organized efforts to steal people's employment information and try to apply for claims and do that in an organized criminal way. So again, we want to make sure that employers, you're an important part of the front line of helping keep unemployment insurance costs down in North Dakota, to make sure that we're only paying those North Dakotans who are eligible and deserve to receive these claims. Okay, next quick update. I touched on this a little bit in the opening, but yesterday, First Lady and myself were able to participate with other governors and first spouses from around the country in a video conference call with President Trump, First Lady Melania, and Vice President Pence. Also part of that meeting, I'll call it a pre-meeting, we had updates from Dr. Fauci, Dr. Birx, from Seema Verma, and some very inspirational words from Dr. Eleanor McCann-Katz, who leads SAMHSA, which is the group that deals with behavioral health behavioral health for the United States. And the First Lady, in her remarks, had an opportunity to thank Dr. McCann-Katz and others, because again, SAMHSA grants have come into North Dakota. They've been received by all of our tribal nations, and they've been received by the state. And again, we know that there is been a huge cost in terms of mental and behavioral health that accompanies the challenges of the stress of economic loss and the stress of isolation that's gone on during this pandemic. She reminded us Dr. McCann-Const, that 120,000 people die annually in the United States related to either drug overdose or suicide, and that each of those lives is equally precious as someone whose life may be taken by COVID. And again, that's why we have been including a behavioral health update in every one of these since the very, very beginning that we've been able to do that. And we'll talk about that in a second. But again, we want to also say that yesterday Seema Verma announced new CMS guidance for long-term care, including recommendations when visitation can resume. And for at the federal level, that's during would be what people would call phase 3. There's no states that are yet in phase 3. We'll use this as guidance. We'll come up with our own North Dakota SMART approach, because we know that what may work for a long-term care facility in a county that has had no positive cases this entire time, and we are able to, through identification and testing, know that those workers that work in that long-term facility are not exposed through contact with others that may be in high-risk situation. We can essentially come up with a risk assessment by geography, by facility, and be very targeted in terms of how we start resuming that. And even as it resumes, we should think about it being staged, where maybe the first step might be that the residents, if they've all, again, this would involve weekly testing of the staff that work in those long-term care facilities, but you might resume with contact between the residents. Then it might involve some limited contact with visitors. It might involve getting people outdoors, which I know that, so that if you're actually having that meeting with your loved one, that maybe it's happening in a courtyard or outside the facility. And again, this depends on the facility's capabilities, but this is summertime is going to create some opportunities to reduce the risk of spread, but still allow people to be connected face-to-face and in person with their loved ones. And so our team is working around the clock, started working last night when we got the guidance on that, and we will keep you posted on how those rules for the roadmap for visitation for long-term care would evolve. But we also are reminded, we had a case in North Dakota where we had a facility that had no cases, and in an area of the state that was more rural that had no cases, and we thought everything was great. And then we went and did the testing there, and we came up with 9 residents and 12 staff. And so it does have a way to get into long-term care in a way where it can be really debilitating quickly. And then we have to continue to understand that we're dealing with something that spreads rapidly in that environment. The next on the behavioral health update, which again ties into the theme yesterday, because First Lady Melania, her focus as First Lady has been around the social and emotional well-being of children, and also the effect of the opioid crisis and the disease of addiction. So this ties right in with what we're doing today, because we know on this behavioral health update, if we can pull up that slide, the COVID pandemic has taken an emotional toll on citizens, and impacts that will affect employees well beyond the immediate crisis. And poor mental health and stress can negatively affect employees' job performance, their productivity, their engagement, their communication with coworkers, and their daily functioning. And employers have a unique ability and responsibility to support the behavioral health of employees as they navigate this challenging time. Having your team know that you're here, meaning your team, meaning if you're an employer, that you're there to support them, can make a world of difference for their both physical and behavioral health. And recently, the Behavioral Health Division released a behavioral health toolkit for employers to support employee behavioral health. In the toolkit, employers refine how to look for the signs and symptoms to recognize behavioral health concerns, supporting employees while they're teleworking, how employers can promote awareness of behavioral health, tips for supervisors, and specific examples of how to support mental health during the COVID-19 emergency and recovery. And then also, again, key things like utilizing an employee assistance program and how to find behavioral health services in North Dakota. You can find out all of this information about the employer toolkit, and you can find that out at behavioralhealth.nd.gov. Okay? And then under the good news section, as we head towards the finish line here, we've talked about this before from the very beginning, but the North Dakota Community Foundation announced that the fund has awarded a second round of grants totaling $209,682 to 44 organizations across the state to improve the quality of life and provide essential services. To do this, we want to thank all of these organizations, the 44 organizations that received these grants. Thank you for serving citizens during these unprecedented times. Congratulations on receiving the grant. And we also want to thank the North Dakota Community Foundation CEO Kevin Dworak, who spoke from this podium early on, North Dakota Community Foundation Board of Directors, and the North Dakota Community Foundation staff for all their hard work in collecting donations and raising that money and distributing grants. They had previously awarded $248,000 of grants back in April, and they've also administered the One Oak Hospitality Employee COVID-19, which provided $500 each to 400 hospitality employees in the Bakken oil field. So again, thank you, One Oak. They're a great corporate citizen in our state, and that was a great generosity on their part. So all told, $658,000 of COVID-19 assistance to nonprofits and residents. And again, if you want to do something to help make a difference in people's lives through this, your local nonprofit that you work with. But if you don't have a particular nonprofit that you want to support, or if you want to remain anonymous, you can donate North Dakota Community COVID-19 response funds to ndcf.net. You give a donation to them. They look at all the companies that are applying, or the nonprofits that are applying, and they'll make the grants for you. And a great way to give and know that it's going to have an impact. In closing gratitude, May 17th to the 23rd, which we're in right now, is Emergency Medical Services Week. And we want to say thank you to all the dedicated, caring, and heroic men and women providing emergency medical care in often very stressful circumstances. These may be career individuals, and across many parts of North Dakota, they're trained volunteers that help out in the local rural ambulance services. So whether you're part of a emergency medical service team that includes physicians, physician assistants, nurses, paramedics, med techs, medical responders, law enforcement, firefighters, medical dispatchers, again, even those that are working on 911, they're a key part of this, educators and administrators that have all been trained to be in that front line of emergency medical services, we thank you. Your quick action and the quality of care has certainly saved lives. And again, they respond in situations of high stress and potentially dangerous situations. And some of those have become even more stressful and more dangerous during the COVID-19 pandemic. But they courageously keep stepping in to help in this battle and while serving their neighbors and their communities. So thank you to all of North Dakota's emergency medical services team members for all the great work that you're doing. Thanks for what you do for our citizens, and thanks for making our healthcare system strong. Closing quote for the day, Amy Collette says, "Gratitude is a powerful catalyst for happiness. It's a spark that lights a fire of joy in your soul." And of course, there's a lot of things to be happy about when you have an opportunity to live and work in a great state like North Dakota with all the great people we have. And certainly hope that gratitude is sparking a fire of joy in your soul. So think about those for which all those things and all those people which to be thankful, and share that, and watch their happiness go up, and watch yours too, because happiness is something that helps us fight off, improve our immune system. And so there's a great tie between spiritual health and emotional health and physical health, and gratitude is one of those drivers, and you can control it. So get out there, be grateful, be safe, be healthy, and now we'll stand for questions. I'm going to start off with Jacob, since he's done such an admirable job of filling in while we're scrambling to get down here every day. So thank you for being the filler.
I appreciate the airtime.
And I feel bad. I've never had a chance to watch you because we're always working on our remarks right to the last end, but I hear good remarks about what you're doing.
Thank you. The fans at the grocery store said I'm doing a good job too. Governor, when you talk about wanting to have a phase 3 or trying to loosen up restrictions for long-term care facilities, at the same time, at least for the past few weeks, the daily positive rates have been trending upwards. The 14-day rolling average has been trending up for the past 2 weeks. What data are you looking for to create this sense of optimism for a possible phase 3?
Well, I want to, maybe Mark can pull up the rolling average, because I want to make sure that we had this discussion last week. I want to make sure maybe afterwards we can connect our team and yours. We're looking at the same numbers, but on the 14-day rolling average, you can see here that it got, it was over 6%. It came down to 2.1. Now it's up to 2.5, and it's, relatively flat line here, bouncing along the bottom. We expect this may go up a little bit more because of the targeted testing we're doing. I mean, we're out there really trying to find positives, because if we find them, then we can isolate them, trace them, and then we can isolate them. We can do that. But as it relates to long-term care, this is going to be really tricky, because this is where we know it has the highest risk, because if we've said all along that this is, has a degree of mortality for people that have underlying health conditions and are elderly. And where are people that have underlying health conditions or elderly? They're in long-term care in North Dakota. And so this is, again, a duty I think that we have to try to make sure that we're, balancing those needs. And I think one thing that we know is that as we have got both the funds and the knowledge now, there's things we can do to improve infection control in long-term care facilities, and there's things we can do to reduce the spread. And as we begin to open up, we have to understand that, not like the entire economy where we want it to open up and stay open, if we open up long-term care facilities and they have a big breakout, then that might be a situation where we've got to reduce visitation again, or eliminate visitation, because you don't want it jumping from a long-term care back into a community spread situation, say in a small rural community where we've made it this far without overwhelming our healthcare support services. We've done a great job of that. So this one is going to be tricky. Even in the CMS guidelines, when they talk about that, there's guidelines in there and recommendations about that visitors would all be wearing at least cloth masks. Some things that people may find challenging, but we'll take a look at the guidelines. And like I said, we may be doing this by county, by facility, is probably where what the team is really digging into right now, because opening up a long-term care facility for visitation in a county that's had no positives this entire time versus opening one up in Cass County right now, those are two very different decisions, and we take all these decisions seriously, but long-term care is potentially a life or death decision, so we want to be really thoughtful about that. I'm going to go Dave and then Scott, and then we'll go online.
Just back on the basic care issue and the $1,200, is there going to be some adjustment or some refund to the residents who have already been affected by that?
If they have already been affected, then the answer is yes. But I think that, well, and again, we'll make sure we scour all. We know exactly how many are 1,143 North Dakotans that are in basic care. We know how many are in this SPED program, and we'll make sure that everybody gets their $1,200 check as was intended by President Trump, by the White House, and by Congress. We'll make sure that they get it. I mean, it was a quirk where they were waiving the Medicare, Medicaid rules federally with federal legislation, but because we have a program that was a North Dakota fully funded program, the federal waivers didn't change the law for North Dakota. So again, we found a good solution with the legislators to come back and solve this.
And just as a follow-up, does the Legislative Audit and Fiscal Review Committee have to look at this?
Where this will go to the Administrative Rules Committee. Yep. Okay, Scott?
I want to ask you a little bit about the long-term care thing. I'm starting to hear from more and more people who actually work in long-term care, and they're expressing concern that the lack of contact with family is doing more harm than the potential from COVID. Even had a story from someone today that talked about a resident that was dying, not eating, drinking, oxygen dropping. I mean, all the signs, the skin, everything else. Family came in because they can at the late stages, and it was a dad. He was up the next day. So they literally thought he was going to die, and family comes in and he's, gets the energy. So they're expressing concern that that's not being factored in enough. And I know that I asked Seema Verma about this as well, to say we're hearing a lot of this. And they now kind of say, well, the governors can do what they need to do there. We've given them the flexibility. Do you have enough flexibility to make the decisions like you say, maybe Watford City can be done differently than Fargo? Do you have that now?
I think we do, because the guidance is not very specific, but it's clear that as of yesterday, CMS is delegating authority to governors, and that's why we're hustling to make sure that we can come up with smart rules. But your example, Scott, is absolutely true. I mean, there's all kinds of studies that show that just even physical touch makes a difference when people are trying to recover from an illness, and so and this is we've taken away some of the tools to help people get better, family supports and connection in an effort to fight this virus. So we got to balance these things, and we've got a real sense of urgency to get this, get it figured out. And at the same time, we have to upgrade our infection control capabilities, because we have a responsibility to protect the people that are in those facilities, and we want to make sure that whether it's visitors or staff when they're coming in, I mean, I think it's a fact that there are some manufacturing plants or some food processing plants in North Dakota and in the country that had higher degrees of, showers and locker rooms and mats that you'd walk across, and people have to change into uniforms and change their shoes and do all these things to get into one of those plants, where we had essentially long-term care in many cases just wide open, because we were managing, it was a different era pre-COVID, we were managing infection control. So I think that like after 9/11, flying was different after that with TSA, and I think that long-term care is going to be one of those areas where we see real changes. And I think, as I said on Friday, part of the solution is it's not just being old and have underlying conditions, it's being in a congregate living situation where you got a lot of staff coming and going. And part of the flexibility we're looking for when our discussion with SEMA is, can we care for people outside of a long-term care and still have federal funding follow the individual? Go to the individual, not to the facility, because getting people who are negative out of some of these facilities right now could be life-saving for them. Get them connected with family and help their families have the income to be able to support them. So we're not just working on infection control. We're actually trying to take a look at the system and say, is there something we can do differently with the system? And in North Dakota, the highest percentage of people over age 65 live in congregate living facilities, and we maybe don't want to be number one on that list anymore. Okay, Danny?
Mike Smith, 660 KUYZ in Williston. The number of positive cases in Cass County is creating a major outlier compared to the rest of the state. The age data also shows that it's not just the elderly being infected. Do you still believe it's safe to restart there, and have you thought of possibly locking down the county to lower the spread?
The answer to the question, Mike's question, is no, we haven't thought about locking it down. Because we have it under control. I mean, the reason you'd lock it down is if you said, hey, we're going to overwhelm our healthcare system. But again, statewide and even in Cass County, we're only using a few single digits of our healthcare capacity for COVID. And so and when younger people get it, then they're not using up hospital capacity in almost all cases. And so we want to keep proceeding on the North Dakota Smart Restart. At the same time, when we know that we have more cases there than other places, that's where we want to come in and direct a majority of the testing and the tracing activity in the state. If that's where the majority of the cases are, then that's where we've got to get in and really try to isolate. If we can find those cases, if there's more cases in Cass County, but they're all at home, then the risk is not higher. It's not everybody's just walking around with it. I mean, it's like as long as we're making sure that contact tracing, we can make sure that people who've been infected or exposed to it are isolating for their 14-day period. We can slow the spread with those kinds of numbers. And again, Fargo's higher than the rest of the state, but there's states that have been reopening that have got numbers that are more than double the size of what Fargo is right now. So it's the highest in North Dakota, but it's still low relative to many parts of our nation. Okay, I'm going Lane and then Jeremy.
Governor, in reference to your changes to the scholarship rules, is that just for high school students, or could that also apply to maybe a community college student transferring to a 4-year looking to get scholarships?
Since I have Superintendent Baszler here, I'll be happy to take a break and let her come up and talk about it. Her team worked really hard on these waivers, and thank you for your leadership, Superintendent Baszler, and thank you for helping to drive these 2 executive orders across the finish line. And also a reminder for people, Chris Jones is here too, and if Chris, you want to add anything to my thoughts on long-term care, Chris is leading in the long-term care task force, or as we call the VP3, the most vulnerable population plan, and so he's doing that. So Chris, maybe think about some thoughts, but Superintendent Baszler?
Thank you, Governor Burgum. So to clarify the question, if I understand correctly, you're asking about the career and the CTE and academic scholarships. You're wondering if they are eligible for possibly some student that might be transferring from a community college to a four-year college?
I'm just wondering if it's strictly for high school students or if other people looking for scholarships to go to higher education can also use those.
So what this executive order specifically addresses is the requirement that is called the North Dakota Academic Scholarship and the North Dakota CTE Scholarship, Career Technical Education Scholarship. And this is a scholarship. These two scholarships are actually earned while the students are in high school, and it's a cumulative scholarship that's awarded for their performance and their academic achievements while in high school. And so one of the components or one of the elements in order to achieve and earn this academic or CT scholarship was the requirement that during their 4 years of high school, that they received no grade lower than a C in any semester while they were in high school in a core course, which would be reading, math, or science. So considering that they have begun working as a freshman, as a sophomore, as a junior, and a senior, to achieve high grades, take the required courses in career and technical or in the academic arena, that this last 9 weeks of their school may have put into jeopardy that ability to earn a C or higher. So in some of our school districts, as you likely have heard from other commenters or other stories that you've done, some of our school districts chose to go to a pass-fail or a satisfactory, unsatisfactory grading system during this last 9 weeks while they were doing distance learning. So with those factors considered, we decided that it wasn't fair that we wanted to provide all of those students that had worked so hard through their academic career of high school to provide them the additional opportunity to complete and cross that finish line, as the governor says, and make sure that they are awarded that scholarship that they've worked so hard to achieve. There is a component that does deal with, in order to maintain, it's a $6,000 scholarship, and so it's quite hefty, but you don't get that automatic $6,000 at the first semester that you enter into college. There is a requirement that you maintain a GPA during your time, whether it be a community college or at a four-year university or a research university. You have to maintain a GPA each semester. That is also included in this executive order. So the scholarship won't be in jeopardy for a student that might be a sophomore at Bismarck State College, and they too have transitioned to that online. So that's also included in the executive order. So I hope I answered your question.
Thank you, Superintendent. Jeremy?
You mentioned that the state would be implementing an enhanced local testing matrix in the Fargo area. Perhaps I'm the only one, but I have no idea what that means. How does that functionally affect people living in Cass County and their access to testing?
It doesn't affect anybody in Cass County relative to their access to testing. As we have said that we were trying to drive towards from what I'll call the outbound testing, that we wanted to have as much as maybe 1,000 tests a day that are being delivered in an outbound way by teams that are supported through North Dakota Public Health, North Dakota National Guard, Cass County, Fargo-Cass County Public Health. One way that we can achieve 1,000 tests is you go to the Fargo Dome and you have a drive-through. And that's like, hey, we're here, come and get tested. This is when you get the worried well show up, and it's very non-specific. With the work that's going on right now, there are over 30 contact tracers working in Fargo Public Health right now. That number is going to be augmented with a few more. And so whenever we get a positive case in Fargo, which we've had more there than any other parts of the state. I mean, it's really terrific and wonderful to look every day at the report and see that we might have a sprinkling of 5 or 6 or 7 cases around the entire rest of the state. In some cases, it might only be 1 in a county. I mean, to be in that position, I mean, we should be just super grateful. I mean, out of 52 out of 53 counties. In Fargo, where we might say in a day like today, you might have cases that are 40 or 50 plus cases in a day. each of those individuals, when they're notified that they're positive, then begins the discussion over the phone interview of, who have you been in contact with, what locations, where do you work? That leads us to having more conversations. And if we find, say, 2 or 3 of those people, they work at the same manufacturing plant, then you might find that our contact tracers are calling up that manufacturing plant and saying, hi, we've got 2 or 3 people that work for you. Would you like us to do a targeted testing for your manufacturing plant? And then they would say, yes, and then we would come in and test all their employees the same way when we went through and would test everybody in long-term care or all of their employees. In some cases in Cass County, we had people that were working in multiple long-term care facilities as a staff. And so that when the targeted testing matrix is sort of a combination of where people live, where people work, where they might be where transmissible moments might be occurring. I mean, it's really a mapping process of what the epidemiologists and the contact tracers are doing. And then they're taking the data from the day before and saying, this is where we found it yesterday. And then we modify the testing plan to say, tomorrow we should be testing here. And so we're really trying to drive the resource towards where we think we can find and then stop and slow and arrest the spread. So that's what those words mean. But part of your question was, what does it mean to the general population? The general population, if you're symptomatic and you don't feel well, then call your provider and go get tested. I mean, everybody, that's what I'll call the, if ours is, outbound, where we're going out and doing this work through contact tracing, but inbound is anybody that doesn't feel well that thinks they need to be tested. And we continue to encourage that all over the entire state, even if there are low number, even if there's never been a case in your county, it doesn't mean that you couldn't have somehow have a reason to be tested, and you should get tested.
I guess I'm wondering why the disparity persists. There is a wide disparity between the active cases in Cass County versus the proportion of testing that the county has received. Why does that continue?
Well, I think that we're working through that, and I had a good call with the unified command, or I should say but a team meeting today. But we have to make sure that we have the ability to deliver that capability and deliver it 7 days a week, and not just 5 days a week. And we have to be able to, again, keep working across the border and make sure that we're working with Minnesota and Clay County, because we know that it doesn't work for us to stop it on the North Dakota side if we don't have an equal sized effort going on in Clay County. So there's more work to be done there, and I would say again, we're getting there in terms of shifting the kind of resource, but we're not there yet. We don't have, if we had 80+% of the positives in Cass County, we do not yet have 80% of the state resource focused on that battle. And I've said to the team, I mean, we're in very few states in the nation are down to a one-front battle, and when we got a one-front battle, then we should just win the war right now, and we should, really dial up the resources and get over there and get it done. And so we'll continue to do that. I'm going to go online and then back to Scott.
Baumgarten with the Forum of Fargo Moorhead. Cass County requested testing for its jail, which was completed today. Will there be more testing at other jails in North Dakota, and will that be conducted on a required or volunteer basis?
I don't have for April right off the top of my head, but I did see a report this morning. I think we have completed testing at the state level on all of the state facilities for the across all 5 corrections facilities that the state runs between Bismarck and Jamestown, Mandan, and then in our partnership in New England. So those are all completed for both staff and for residents. And I would have to check and get back to April on the question about the where we are at the county level in terms of county testing. But anytime we've got congregate situations like that, and maybe I'm sure that's part of the populations that Chris Jones and his team on the VP3 are looking at. But I'll make an assumption that that's part of the plan, but we'll have to get back to her specifically. Scott?
It's a question from a listener. We asked what questions they had, and this is one we actually hear quite a bit, so I'm interested in your answer, and so will the listeners. Is distancing and hand washing enough? I wear a face mask in stores, this person says. I see many who are not wearing masks, I wear a mask to protect others from a potential virus without symptoms or known contact. Why should or shouldn't people wear masks in stores?
Well, on the first part of the statement, hand washing and distance are two powerful tools. I mean, hand washing can rid the virus from the way that we would normally spread it, because it lives on surfaces, so that's great. Distancing, again, we know from the very beginning that 6-foot distance. They believe that, of course, it depends on temperature and humidity, but the air droplets, somebody coughs or sneezes, you've probably, seen that thing where they highlight it with a light and show the, the stuff that is floating through the air. So those two things alone can stop a lot of the spread. But if you're in a spot where you can't control your interaction with others, and say you're, shopping in a store and you're shopping for your elderly parents or for a child that's got an immune deficiency, if people want to wear masks, they should wear masks because it will help protect them and their loved ones. And I think I'm worried that there's in North Dakota, somehow, maybe more than other states, I can't say for sure, but it seems like sometimes we care a lot about what other people think. And I don't want to call it like the mask stigma, but like that somehow if you're wearing a mask that there's, that you're, not macho, or you're not, for a strong economy, or not something. And I just hope we can eliminate the stigma and support people. If people choose to wear a mask, whether it's to a movie or shopping, they may have a very good reason for doing that. I mean, they may have a 2-year-old that's got an immune deficiency, and they may have all the reasons in the world to say, I'm going to protect my loved ones, not just elderly. And so again, that's what I'm saying. We have to have the empathy and the understanding that that not all of us are in this situation, because we get barraged in our office about, open up, open up, open up. And we also get barraged in our office by people that are elderly and have underlying health conditions and have every reason to literally be afraid for their life that they might get this thing, and this may be and they may, and again, who wants to die, and who wants to die alone? And so we're hearing both sides of those things. And so I just think this is a time period, during this period of opening up, that North Dakotans have to really dig deep in terms of their patience, their kindness, and their understanding. Those are tools we're going to need to get through this, as much as we're going to need science to get through this. Dave?
Do you have any best case recommendations that that you mentioned? Hand washing and distance are the two big things. In other words, if somebody's doing that, are they, they checking the appropriate box? Then maybe if they're concerned about, as you said, underlying conditions, they're doing that and lose the shaming, if you will, or whatever. Mm-hmm. But I've also heard that really, unless you're in close proximity for like 10 minutes or more, is where the real concern is. That that's where you have the best chance of getting that. Do you subscribe to that?
Well, that's when all of the best data we have, and the epidemiologists, when we do contact tracing, they don't say, who are all the people that you passed by in a big box retailer last weekend? They will say, are there any people that you've been within 6 feet of for 10 minutes or 10 minutes or longer? Well, if you work on an assembly line and you got somebody on either side of you, pretty easy to identify, yeah, these are the two people that were right here. And that's why we saw this spread through some of the food processing facilities or others. And so, yeah, it does increase the transmissible moment when you're in close proximity to someone for a longer period of time. Those are a fact. So that's what we're looking for, not the I walked past somebody on a sidewalk. Dave.
This is for Chris Jones.
Fantastic. Dave, you are a gentleman for always saving me from the podium. Chris Jones, head of Department of Human Services and also the leader of the VP3 task force. Chris, welcome back.
It's a two-part question. Number one, how are you coming with protocols in order to implement the VP3? And also, have you been coordinating with the North Dakota Long-Term Care Association, who has a task force they're setting up in order to try to open things up in nursing homes and long-term care facilities?
Yes, thank you. So the protocols, for the most part, have been set up, and we're following them as best we can. But I want to reiterate that we're always looking at them on a case-by-case basis, that it can't always be a one-size-fits-all. But in order to start the discussion, we have to have the protocols in place. So those have been our starting point. As it relates to the visitation, just to follow up on Governor Burgum's comments earlier, this is what I would add on to, is we are working with the visitation committee. I did speak over the weekend as well as last night with their chair of the visitation committee. It's a resident. So I think it's important for people to understand that the state isn't just going to come up with visitation guidelines that we're going to follow. It's how do we all work together with residents, with long-term care, and the state to make sure that we're protecting everyone, not only from the virus, but also from heartbreak.
Until you get the testing apparatus that the governor was talking about earlier, of sort of, having one protocol for a manufacturing facility, but having, kind of just coming in and getting that infection control in place. I mean, as people are chomping at the bit to see loved ones, is this a week's thing, a month's thing, a year's thing? How long before you're testing residents in addition to staff and family possibly to be able to visit?
So at this point, all but 3, well, actually 2 as of today, have been, all 216 of 218 have been tested. I think it's important for people to realize just that you've been tested once doesn't mean that serial testing or ongoing testing isn't going to occur. And the clinical protocol for that is best practice is 7 days. So there is going to be that lag. And then what the governor previously said about how do we look at what the risk is? How do we look at all the risk factors? How do we mitigate the risk factors? And then how do we make educated risk judgments as it relates to preventing the spread as well as protecting people's mental, behavioral health and wanting to see loved ones. So I hope that we will have something for review and discussion by Friday, and I'll set the goal of Monday that we will have some visitation guidelines out.
Tom Simon, Williston Trending Topics. A couple weeks ago, Bethel Lutheran Home discovered 2 asymptomatic cases among residents. Further testing didn't identify any further cases among staff or residents. And later, those 2 patients are reported to have been retested and tested negative. Can you explain any discrepancies in testing? If you can answer that.
I can't clinically describe any discrepancies in testing. I haven't been following the clinical side of it and which tests they did and which ones are more accurate. But I think it's important to remember that there's a number of people who test positive who also recover. And as we look over the last 5 days, we, up until this afternoon, have had more recoveries in long-term care in Cass County than we have active positives. So as people are testing positive, if we're doing our job, we want to prevent them from getting the disease, but if they do get it, how do we work with them to help them recover? So they may have recovered on their own.
Okay, heading to the finish line, a couple more questions. Got one online and then Scott.
Jean Shemp, Hometown Radio Group. NDDOH tells me that of all the confirmed positive cases in North Dakota, 36% of them were asymptomatic. Was this always the case even when surveillance testing included general public, or has the percentage gone up when you switched to targeted testing? And is this number alarming?
Not alarming, and don't know if it's gone up because I haven't seen the graph, but that would be a good one for us to take a look at. So Gene, thanks for the suggestion on the percent asymptomatic throughout the entire course of this. So we'll get our team and see if we can dig that one up. Scott?
I want to follow up on your assessment on the unemployment situation. I hear from employers every day that their biggest struggle right now is getting people back. I usually follow up with, why do you think that is? I mean, are they afraid to come to work? Are they, they opted something else, or what? He said they're making too much money on unemployment. And it's not just like a 1 or 2 thing. I'm hearing it a lot. And a large part of that is that extra $600 that was layered on. So the average person in North Dakota is a little over, $1,000 a week in unemployment benefits. A lot of money. So if you're making $60,000 a year or less, you're making more on unemployment. So my question is, I know you and I have talked about this before, and I don't remember the timeline on your thinking, but North Dakota can opt out with a 30-day notice of the $600 a week deal, which currently goes till July 31st, but most likely will be extended as a compromise in whatever next stimulus package is, because the Democrats already have it in their package to extend it till the end of the year. Which obviously would be a tough decision because some people probably need it and can't go back to work, and others not so. What's your plans on that?
Well, I think as we get closer to the, into the summer, we'll have to take a look at that and see where the numbers trend. I actually would hope that it would not be included past July 31st. I've had a chance to talk to, other governors that were serving in the, called the Katrina era, and the federal government had a program like this for an area that was affected, and they kept extending it, and they kept extending it. And every time they extended it, then that just hurt businesses being able to get back to, they couldn't figure out why the economy's not going. Well, as you just described, Scott, if you pay people more not to work than to work, some people are smart enough to say, that's what I want to do. And so it is I think that, and it's not a good use of taxpayer dollar to pay people not to work. I mean, there's value in work, for the individual as well as the employer. And they say that, Theodore Roosevelt, great prize in life is an opportunity to work hard at work worth doing. And if people have a job that they don't like, then they should find a job they love, as opposed to saying, I don't like my job, I'm going to take the federal unemployment check. Because if we get our economy back to where it was before, we had 30,000 jobs open. There's, everybody in our state ought to be able to work at their highest level of skill and their highest level of fulfillment. And if they aren't, we got 100 ways to help people get the training they need to get to that next level. And work should be part of the joy in their life. And if you're, like I said, if you're on unemployment because you're unhappy at work, then, and before this thing, I would put that back on the individual, not the employer, because go look for one of those 30,000 jobs. There's employers that would love to have you, treat you well. This has been a market that has been strong for employees, and will become strong for employees again, in the sense that they got a lot of negotiating power when you've got that many. I mean, we're the first time in the history of our country where there was more jobs available than there were people seeking jobs. I mean, that gives this job seeker enormous amounts of power, whether it's negotiating their salaries, whether it's negotiating, I want to have more education, and I think that's the beautiful thing about our system. When we start paying people to not work, that's starts to erode at the very core of our society and our core of our economy. And again, I think that it's when we talk about saving lives and livelihoods, part of that livelihood is the self-esteem that comes from having a job and the satisfaction of a job and doing it well. And we want to get back to that underpinning. And unfortunately, this is a partisan. It's a very partisan thing about whether it gets included or not. People view differently about it, and people say, "Where'd the $600 come from?" Well, $600 is 40 hours a week times $15 an hour, and if you said, "Hey, we want to make sure that everybody gets that kind of minimum threshold to get through this," that'd be great. But that $600 came on top of what was already a generous check from the state of North Dakota. That's where you get to your $1,100, where 52 weeks, you get, your math is right, $62,000 a year. It's when I've had the same calls. People are emailing me and saying, "Why should I work?" Because my husband and I can both make more money on unemployment. So when people say, "Why are the unemployment claims so high?" Part of that is because maybe people in North Dakota are good at math, right? I mean, why wouldn't you apply for a claim? So I think we won't really understand the true unemployment situation until after July 31st. Okay, I think you have one last one, Danny, or not? Good? Okay, listen, thank you, Chris. Thank you, Superintendent Baszler. Thanks, everybody, for being here, and being here, for some of you being here in person. Fun to see you in person versus online. And for all of our viewers, grateful for you, for everything you're doing to help spread information. I've heard this called not the pandemic, but the infodemic and the panicdemic, and we want to make sure that in North Dakota that we are focused on facts, not fear, and that we understand that all of our optimism is grounded in some great numbers because of all the great work that all of you have done. So again, thank you for everything you're doing, and thanks to everybody that's getting back there and getting going. And whether you're in ag or energy, and I know exciting to see President brought it up last week, Wednesday. He brought it up yesterday during the call. He must be watching the WTA price every day, and fun to see that back up in the 30s, because that's a number, price per barrel of oil that maybe we'll see the shut-in stop. Might not be enough to get people to get back and opening wells up again, but maybe it'll stop the shut-ins, and that's positive for everybody in North Dakota, given the amount of revenue that our state derives with our partnership with that industry. So again, lots of positive things to be thinking about, and we did get through this was the day that was the end of the contract closing a month ago. This is the day that produced the minus 37 in terms of that historic day in terms of trading, and that anomaly did not happen today. And so that means that the markets see that there's both demand for the product, and that there's also, at least for the near term, a place to store it if there isn't. And so that's also good news for all of us here in North Dakota, that we got through a tricky day of trading today without seeing a big drop. So good news, lots of things to be thankful for. And again, thank you all, and we'll see you tomorrow at 3:30.